menopause is not a disease, it's a stage of your life, but how you manage it and have a good quality of life, that's what people need to know. Late 30s to early 40s is when you will see the symptoms of mental health, the physical symptoms, and actual health. If body is changing, you honor it. This is some symptoms have started. I am not the same woman.
Hi, welcome to Changing Suits. My name's Bal.
My name's Taj.
My name is Veerpal. Sorry.
No, it's fine. There we are. We've got a very eager guest, which is always nice. might be our third host from now on then. Today, as many of our listeners know, we are embarking on a big project, namely looking at women's health. And one of those areas is, of course, menopause, which we've spoken about in the past. Today, we've got Veerpal Sandhu, who is a clinical pharmacist, and she specialises in menopause and mental health. So we really wanted to touch on the impacts of menopause, and also what are the symptoms of menopause as well today. So hi, Veerpal, how are you today?
Hi, I'm very good. Thank you for having me today here.
Thank you very much. Now, in regards to menopause, when you say you're a specialist...
Hey, Val, I'm going to stop you there.
Oh, that was quick.
What's that? So can we find out, first of all, because it was only through podcasts that we'd done previously that I found out what perimenopause was. So when does perimenopause roughly, because I know it's not the same for every woman, start? And then just a timeline for perimenopause and then menopause. That would be amazing to know.
Okay, no, that's fine. So first of all, menopause or perimenopause, menopause is not a disease or illness. It's a stage of life. So you're a human body, even the animals, everyone have hormones, and through the hormones, you go through the different stages of life. So we are teenager, our hormones are different. Then fertility age, the hormones are different. When the fertility age start to little bit decline, depend on our ovaries and the cycle. And then the menopause is the third stage actually. It's a 4 stages of after the fertility when it start to decline. So first is pre-perimenopause, when little bit we say signs you can see in your body. Maybe the periods start to get changed or any physical symptoms, but you are not actually even into perimenopause. It start a little bit decline and you think, okay, something is changing in my body. That is pre-perimenopause. And then that normally start early 30s. Not every woman will feel it. It could be one, maybe a sign, that's it. But it wouldn't, no, if we got 80 women, 100 women, out of that, maybe 50% or so maybe feel one or few signs. Then perimenopause is, yeah.
Well, the stage before perimenopause and the pre-peri.
Yeah. Pre-perimenopause and then perimenopause. That's, as I said, not everyone, but that's your body start to prepare of little bit of that change. But maybe 1 or 2 sign, maybe there is a tiredness, or be a little bit of period change, or maybe just mental health start to get affected. Like you start to get stressed more, or your body shape start to change. Your metabolism start to change, the food habits start to change. So it could be just one sign. But
funny, you know, like for example, there's certain things that you like when you're younger, like you used to hate glele. I don't know what they're called in English, but and then when you get older, you're like, I don't actually mind these. And so even your tastes change as well. So that could be the reason why we prefer or don't prefer something when we're younger. As we get older, our tastes do change.
Change, or you may suddenly develop allergy to something. Like I can't have milk now, and I all whole my life I had a glass of milk before I go to bed. From last 3 years, 4 years, I'm 39 almost now, and I can't have milk. I will have indigestion and sickness next day. I can't have milk at all.
I can tell Bal was like, oh my God.
No, to be fair, I actually thought so. I think when I hit 30s, I did feel like there were slight changes, but I put that down to even tiredness and what you've said there. I put that down to having kids and that process. I suppose it all merges into one anyway.
Hormone change. Yeah, it's all hormone change. Yeah. You still, up till 50, you're still in your fertility age. You got to remember.
Okay.
It doesn't mean you can't be pregnant, but the things start to change because your body is changing.
Right. Okay.
And then the
is preparing for menopause then.
It's preparing, yeah.
Okay.
You can't stop it.
Wow, another
the stages of life, you can't stop it. There's no way, but it's how you can have a good quality of life.
Okay.
Like these days, the lifestyle is everybody hit 40, they're gonna get blood pressure, cholesterol, and diabetes. That's it, the lifestyle. But menopause is not a disease. It's a stage of your life. The same way you became teenager, then you became mom, or you whatever your fertility journey was or not, and then the next is start to decline slowly. That's your change in is the stage of life. You can't deny it, but how you manage it and have a good quality of life, that's what people need to know. And some women, it may not affect at all. It's just normal. There's no changes at all. So then perimenopause start, and that's where you will start to feel symptoms. And that's menopause is after. So perimenopause is like really, you start to feel a very different woman. People start to say to you, you're not the same. Something has changed. And I always say there is three, I always, because I see a lot in my NHS job and private, a lot of women, the symptoms, because it's all around to the symptoms we see. And I divide into three symptoms. Everything happen in perimenopause, actually. Menopause is the later stage. That is, everything is gone by then, basically.
You know what? Where you've said that you do have these changes and it will affect your personality and character. I mean, I'm just thinking it now. You've said, oh, it starts in the 30s. I hadn't even thought about it because I just haven't. But perhaps it is a case of what I do actually need to talk to my family and say, look, this is, I will start having personality changes. You think I'm great now, just wait till I hit menopause. So
yeah, it is definitely. Yeah, late 30s to early 40s is when you will see the symptoms of perimenopause. Some women do start early 30s, but it's not a big average, but mostly average number if we look for is late 30s from 35 to 40 to 45. That's when we look for it. And I always divide into three category the symptoms: the mental health, the physical symptoms, and your life, your actual health. That could be your body shape, your weight, BMI, and what else you're going through. And the woman will always have the mental health symptoms first, then any other physical health symptoms. So the
I think
mental health,
that helps the way you compartmentalized it. It helps
yeah,
to understand it more. So,
yeah.
sorry, what were you going to say about the mental health? Because I'm really interested about this bit.
So the women who have mental health symptoms is like, that's when it starts first of. Mostly women will start the mental health symptoms. Anxiety, they start to feel the palpitation and anxiety, the stress. Getting late for 5 minutes is like end of the world. If someone drops something in the house, they can do a murder on it because they can't control it. 1 minute they're happy.
she is totally going through it.
I'm going through it. I know I am.
So 1 minute they're very happy, and on second minute they can murder someone. They means your family will label you as a bipolar.
Yeah.
The number of fights we've had now, I just thought, okay, it's just,
Yeah.
but it's this.
Yeah.
Yep.
So you will turn into, yeah,
you will. Because I'm going through this.
Yeah. Low mood, lost confidence, very emotional. For anything, you will just do a fight and then you just cry.
Because I quite a lot of, because now my peers are roughly my age as well, which is 42. I'm going to admit it. And we are, quite a lot of us are saying we're feeling frustrated. And one minute, like you said, you've got low mood. Next minute, you're really happy, and next minute you want to cry. But what can you do for the mental health side of things? Because we have heard about symptoms, but I don't think we've gone enough into where we can get the help and what we can do.
Yeah. So that's where I obviously, then we see what other physical health symptoms along with it is as well. Because a lot of time women are booked with my mental health clinic because they're saying they got anxiety, whatever is going on, they can't cope with emotional, or they're low mood or depressed. And then when I do the other symptoms with them, that's when actually they're going through the menopause, perimenopause stage of change. So that's what we really, really start to look into further. So then these are all the symptoms of we start to compare, women start to compare themselves more to other because their body is changing for other physical, and that's when they end up with having depression. It's not only an anxiety or agitating, and it's 50% women do get really low phase, very low mood. They must be very happy, outgoing, proactive, and now they can't be bothered to even have their self-care all the time or go out. They will find every single reason not to go out of the house, and they're depressed. And then we look for the physical symptoms, which we say above on the surface physical symptoms, which you can be visible physical symptoms, are hot flushes, unable to sleep, palpitations as well, sweating, uncontrolled sweating. So these are the main symptoms the women start to feel if they are getting, and because they all linked. If they're getting hot flushes, palpitation, they link to mental health again. If they go hot flushes, they're not unable to sleep. If they sleep, they're tired. They're tired, they're frustrated. So they all link to each other. So then we see, okay, this person is saying I'm anxiety, stress, or agitated, or frustrated, low mood, depressed. What other symptoms they go? Have they got any hot flushes? Have they got palpitation? Have they go? What are the other symptoms? And then once we done the physical, these are the over the surface. You can see someone's hot flushes. You can see their palpitations, or
This is
they
all in
can't sleep.
perimenopause still.
They are all in perimenopause, and not necessarily every woman will have, but some majority. Then we see how many symptoms they are other having, and then we see other physical health symptoms. Their body shape is changing. Mostly women do start to put weight on, like even they drink water and it's like they will put 5 kg on because metabolism is changing, their gastric system is changing. They start to get more bloating and the heartburn.
Could
That's
it
of the
go the other
gas.
way where you lose weight? Is
There
that
is some women they will lose weight because what happen normally, how the link is, they are stressed, or again it started from the mental health. They stress or something, they stop eating. And when they stop eating, and that's when they start to lose weight. But majority of women do gain weight than losing. But there is one category where women will lose weight. But what normally is their genes, they're always a thinner woman and they start to lose more.
Oh, really?
So, when women who genetically they won't put weight on, no matter, they don't need to do anything, but it's the same way they struggle to put weight on. That's their struggle. Like women struggle to lose weight.
that's
There is
funny.
women,
Yeah.
yeah,
God, so
they
everything
struggle.
that we're saying is ticking the boxes
I
because
was
you
Yeah,
used to be really skinny and now
yeah,
you've put weight on, and
yeah,
I used to be bigger and now I'm losing weight. We're going the opposite ways.
yes.
It's
So
exactly that. Now you've said, oh, from the 30s, and I do think that this did start, and I did start noticing those
body
the
shape change. Yeah, your
at that.
thighs, your tummy, and mostly the abdomen because your gastric system is changing. That's mostly, and your thighs, it start to change your body, which wherever it need to go.
Yeah.
And then women will
I
lose
don't,
the weight.
I don't know if you can answer this, but do men have a sort of menopause that
Yeah, they have testosterone start, androgen start to change, and that's why men's body shape change as well. The men do go through menopause. Obviously, we don't call them, but they
or
do go.
what do we call it then? Because I
Means
don't
it's
know.
menopause. It's men menopause we call it. But
Oh, so
clinically, if we look,
there is a thing then.
yeah,
Oh,
there is. Yeah.
wow.
And if there is, we look clinically, and because they got testosterone and androgens and these hormones, and that does affect them.
How
And then it's
at what age do men go through?
men start more later than earlier age. So with men, it's mostly men will start to change from 40s.
Why do they always get it better than we do?
They have their own struggles. Let's not go there, bichare poor men. But they have their own struggle. Oh, because obviously men struggle for more mental health than women, but we never talk about it.
Okay.
Men is a big. We have more very high suicide rate in men than women.
Yeah.
Yeah, yeah.
Okay.
So they struggle. It does affect them in a different ways.
But then why isn't this is kind of going really off topic? Why isn't it spoken about? I know at the moment it's a big thing. There's a lot about the
Because
awareness.
men don't talk about their own issues. That's the problem.
But then why aren't there like professionals that are talking about
There are
men?
professionals are doing, but because now we women means menopause is from centuries,
Yeah.
isn't it? Why are we 5 years? Because now every single person is taking accountability of it and talking about it. Men at the moment, men just touching the mental health. It has improved in men, but there's a lot of work on mental health first, and maybe in next 5 years, 7 years, maybe sort of more awareness of menopause as well.
I'm
But
glad we
before
found this out. Wow.
but
Okay.
men never used to talk about mental health before. It's just from last 5, 6 years, it's more awareness because if we go 100 men and 100 women, only maybe 5 or 7 men would openly talk about mental health. It's increasing a lot more awareness. But where women, when you put them in a room, everyone will start their struggle, but it's opening up is very hard with men than women. And it has to be when we have to raise awareness and we have to talk about some issues, it has to come from members of public. Professional can only do so much. It has to come from a common person who's going through it means every person, every human is going through it, but every person needs to be open about it. Now, every woman is open about it, but it will take time for men to open about it.
But it feels like just recently, I'd say it might not even be the right numbers, for the last 5 years, I would say, there's been so much more about women
Yeah,
talking about
yeah.
menopause. But why wasn't we must have been talking about it before. Why is it
It
almost
was in the books. It was in the books. And there was obviously research was there because obviously it's building up from years and years, but it's the internet now. We didn't have, it was only newspapers or books, and then the lifestyle is changing. The symptoms are, there were symptoms before, but lifestyle was better before.
Yeah.
Food was better, life wasn't that busy, people were talking about their feelings. I remember my nanny or my daddy, they always used to talk about different topics in their own language, and they had their own signs and cues, so they were talking in between them, but obviously it wasn't awareness like this. But then the food was better, the lifestyle was different. Now we women, we are another species now compared to the women before. I'm not saying they were not working, they were working hard, but there was not too many distractions. How much pressure we have on our mental health now? It's like your
You feel
brain
like
is
you're being eaten.
divided into like 1,000 compartments in a day, and you reply in the WhatsApps, the Instagram, the social media, emails, everything. That time that was protecting their mental health.
Mm.
The comparison, the FOMO of everything, there was not that time. Worst case, they had FOMO in their own village or in their own area or something, and that's it. But it wasn't that much exposure. And even with the children, to manage them in different way, it was different for women than now. Like we want to do 20 activities for them. It was different for them because children weren't playing themselves.
Veerpal, can we, because we've spoken about obviously the physical as well as the mental health, and the last department that you did say was the
Yeah,
health.
so we were talking about the physical. So the gastric system symptoms is start, and then it starts your urinary, which we say the periods start to change, urinary infections, and bladder change, uncontrolled bladder as well. Some women will suffer from that. They know means we do say it's related to the given birth, but obviously some will have the incontinence as well. More urine infection they will start to feel as well, vaginal dryness as well. These, and then some may develop blood pressure or some heart or other issues as well due to menopause changes, the hormone changes as well. So these are the symptoms which we divide it into. And then obviously more which women do start to feel is the confidence and the low mood as well, is which is linked to their skin. The way they look, their skin start to lose, they develop the acne or hairs on their face or melasma, hyperpigmentation, especially in our community, is more hyperpigmentation and melasma, like brown patches on the cheeks or face. Yeah, and then elasticity, the skin start to look very sunken and it start to drop, and that obviously affect their confidence. And then the same, the weight gain as well, and then the hair thinning, hair loss as well. So
Because
these
before I
four.
would have just put that down to old age. You're just getting older, so
Yeah,
these.
but then the reason, the clinical reason is the estrogen hormones start to decline. And this is the hormone balance, estrogen, progesterone, they control it, they manage it. When they have imbalance or they start to decline, that's when our collagen, if we look for skin or hair, the collagen start to drop, and that's when it happen. And obviously does aging as well. In aging is our body start to function in a different way, and then our body function on hormones.
Okay,
It
so
function on the hormones.
in regards to obviously with God, it's sounding a bit.
It's so much.
I'm like,
That's why there is books and books being written. But if when we talk, when I tell to my patient, it's a simple language. If you start to control from each section one or two things, you start to look, is that is the overall, but not every symptoms will. So then women start to look, what has changed in me? What have noticed change in me? It could be only the mental health. It could be just few physical symptoms. And as I said, it's always start from mental health symptoms. Then it goes to physical. Physical, mostly women have hot flushes and these maybe around 40s, early 40s, 42, 43. That's when they, mostly women who come to me, that's when they start to feel symptoms.
Could it be
Uh,
opposite where the person is just cold rather than the hot
yeah,
flushes?
cold, yeah, cold. Yeah, we see the tingling in the hands and feet as well, and the limbs. The extremes we say, like the limbs, like your feet or your hands would be more colder than before as well.
can I ask, is there any good things, good symptoms? Because these sound really, really tiring. I'm like,
It's a new chapter of your life and you take a control on it and then you totally take in a different way. But it does make you very resilient after. Once you have
you
control
have
on
to
your
offer
body.
that many problems that you have to resilient, otherwise you're
No,
done.
it does. So when women start, and when first, because the problem is it take good few years for women to understand because it's sort of not acknowledging it, so sort of declining it. Like no, it's no menopause. If body is changing, you honor it. This is some symptom have started. It could be nothing to do with menopause, but I am going through a change. There is something changing in me. I am not the same woman. I am tired all the time.
Sorry, how comes GPs aren't picking this up? Because I've heard quite a lot of times where women have gone with symptoms and it's just not picked up as menopause. You said there's loads of books that have been written, it's been going on for years, but
It
yet
is.
GPs haven't even been trained in the area. Why is that?
Not every GP is trained, and sometimes that's why awareness is going to the member of public. So when I have menopause clinic, so as I said, I would be booked a patient. A patient will say, I am depressed or anxiety or stress. Can I book appointment with a GP? They booked anxiety, stress, and they just say, I am sad, I'm anxiety, and this, and then that's it. They get pills. That's what happens.
Yeah.
But because when it works both way. First of all, GPs, it's not all GPs' fault because only get 10 minutes for an appointment. And to do a menopause consultation or a proper mental health consultation, you need a half an hour.
Mm.
You're trying to see what actually is happening. Is patient gone through trauma or something has happened? What has triggered? You need to talk to the patient. Only the best person who can tell the GP what they need to hold up is the patient themselves because they are the one who holding the body. They need to tell maximum, and then the clinician can say, okay, I think this is going there, and then they make a plan. We're going to try the first choice this. If it doesn't work, then we do next.
Veerpal, can I ask, because like you said, look, appointments are 10 minutes, and that is, everyone's, especially now, at a really tight schedule. That's fine. But if the GP then says, yes, I think it's down to menopause, and they don't have a menopause specialist within their practice, can the patient then request a 3 block appointment where they get that
Yeah,
30
that's
minutes?
what happens. Yeah, so that's what happens. So when they say, okay, this is what happening, the blood, first of all, if even you say you got symptoms, I am tired, lack of energy, this is what happening, we will still do the blood test. It's not like blood test is gonna say positive menopause or negative, but to rule out there is not something going else in your health and we sort of missignal the symptoms. Is it not thyroid? Is deficiency of something or heart or something else going on? So it's definitely we have to clinically check your body. Everything is okay with your body.
But the blood test, it isn't something that you can say, right, the menopause has started. It's checking all different levels
Yeah,
of
different
everything.
levels of everything. Yeah. And we have hormones which we can check, but a lot of time you will have symptoms, but your levels will come normal because it's the cycle of your you may have periods, you could be on a pill or you're in a different stage of the 4 week cycle. So, but we always to give something, we go for the symptoms. We go for the symptoms. We always say, we tell the patient. So when a woman know that's why symptoms is very, very big awareness. You check your symptoms, you know your body, how it was before and how it is now. If it's having any of these symptoms, I have got a scorecard. I will send you a link when you do
Yeah.
release it. Put the scorecard on there. It's the same way I said. And then if the score is high, you know it has changed. Then it means you're going through a change. I have a lot of women who message, no, I'm not going through a change. And I said, just try something, see. And they started something, and it does help. And then the GP, if clinically you can't have HRT because it could be some other your family history, whatever it is, or person's choice, then the GP can only say lifestyle change and HRT. Lifestyle change is must. The food you eat, if you're more going through mental health symptoms, how are you protecting for yourself? Are you giving time for self-care? Are you protecting for all the external exposure yourself? Are you taking time to have a break if you go really stressful life?
Well, can I ask you something on that point? Because of the symptoms start, and you've said early 30s, your body's starting to have that change. Do you think if someone does start looking after their mental health, physical and health, at early 30s, do you think it then makes it easier to
Yeah,
go?
it can make easier. Yeah. And it all depends how bad the symptoms are as well to the person. Some may not notice at all.
So basically, because we're doing a lot of awareness stuff about menopause, so we should be encouraging not only ladies, but everyone should be involved in this to start preparing at 30 rather
Yeah.
than waiting till, I don't know, it's well, I don't think it can ever be really late, but quite a
Yeah,
long down the
yeah.
journey.
Yeah, you at least when it does the symptoms start, you know how you're gonna manage your body. If someone, people, panic attack and palpitation, heart pressure is very, very uncontrolled situation. You have no control. You could be just sitting here normally, and people who have sort of more forefront job roles and they really, really struggles. Like the heart sweat will come and they have no control on their body for that moment. And if they start to see the signals before, maybe start to see if they a little bit obese or have overweight, start to look after more, eat healthier, any triggers they avoid as well in that time. But prepare because even it's no menopause, you're preparing your body for aging then.
Yeah. The other thing is, I mean, everyone always says healthy eating and exercise. How much of a difference does that make? If you start at 30s, I don't know, and this might be you're asking me a clinical question and asking me to get figures right from the air, but it'd be interesting to know what difference does it make if you do start at 30s, start exercising, eating healthy? What effect does it have on those symptoms as a percentage, does it make it easy?
70 to 30. So you can improve your health by 70 to 80% just by with your lifestyle, regardless what is going in your body.
Oh,
Your
wow. That's
diabetes,
pretty high,
people,
isn't it?
yeah,
Yeah.
people have control on their diabetes. They come off from insulin because they worked on their lifestyle.
Mm.
Same blood pressure and anybody because this is controlling. You will still always will be diabetic, but you control the symptoms and your levels gone down. And the same way is for menopause. You will start to work on your lifestyle. You're having a good new because you're controlling the symptoms. If you are always tired, lack of energy, don't have that, so your aches, bones hurting all the time because that's another symptom. And then you having a good vitamin D, good iron, good nutrition, those symptoms gonna go. Gastric, if you're having a good healthy meal and balance, you know your triggers, what your body can't tolerate. You can't have spicy food every day. That symptom is gone. And then you're protecting your mental health by going for a walk, giving a break yourself. If something don't serve you good, someone really taking your mental health energy, you know how to minimize that as well. That's
I
gone as
feel
well.
the fact that you said that, I feel more positive about it. Like there is light
Yeah,
at the
and then
end of it,
you
but
take
you can.
control, and by the time you hit 40, 45, leave me alone. I don't care. This is my new life, and that's it. And that's then you take because you have made yourself that resilient. But that's what happened. By the time, because women struggle, so it start early 40. It took her 5 years to understand something is wrong with me because year goes so quick. By the time she reached 50, she is really down on the bottom, and it's very, really hard for her to come back. It's a
Mm.
struggle to start exercise or eat healthy. And that's when women give up on their life and they come 60, they come in elderly category.
Do you know what? That is just
Yeah,
think, and this is when you sort of realize that this is going to sound really philosophical, but life is really short. Because if you're saying,
yeah,
look, this is the preparation you need to have at 30, but it even starts before that because they start saying bone density starts reducing. What is that, at 21, 22? It starts declining after those at that age.
yeah,
So literally, we need to be bringing up our kids to be healthy, not only for their immediate health, but also for the next 5, 10 years and the ongoing impacts. And I've just realized how short life is if we're doing that at 30s, that we need to prepare for menopause. That is
yeah.
amazing.
It is. And then age is like we have more older people now, even though we had more older people, but we had more older people, healthy people before. Now, after 50, very rarely people are healthy. Now the awareness is coming since COVID 2020, people are more healthy lifestyle, but the damage is has happened so much now, obesity and weight gain and everything. One, our food is not good. We all know what we eat, isn't it? The fertilizers, everything is need to be quick, quick, quick.
Can I
So
ask you, so they say so that's at 30s if you start preparing for the menopause. If you were to start at 40, and that's quite a big percentage, 70 to 80% where you could reduce the symptoms, that's amazing.
you can control your symptoms. Yeah, you're still gonna go through perimenopause, menopause because that's the stage of your life. Yeah,
It'd be
but
easier.
yeah, it's quality of life. You improving your quality of life and making it better. And so it's not taking your life away from you, basically.
In regards to medication, HRT, we've had so many podcasts where we talk about menopause, but we haven't gone into HRT, and I think this is a perfect opportunity to do it. Could you tell us a
Yeah.
bit about, or a lot about HRT And also, I want to ask you a few questions afterwards in regards to GPs prescribing patterns as well. So, yeah, HRT, what is it and what does it do?
Before you even start that, would you go to the GP and say, I've got all these symptoms, right? And they'll go, okay, HRT is the treatment.
Yeah, so because clinically GPs can't do anything. Only thing GPs can do is advise you on your lifestyle, give you resources to have information, that's GP, or it can write your prescription. And that is how you can manage the menopause. That is the fact. So when I do issue prescriptions for HRT all the time, so when a woman comes to me with miss and hit menopause symptoms, they don't know what's going on. Basically, they say, I am fed up. I don't want to live anymore. It's taken my life away. Tell me. And then you dig down the same way, ask consultation, everything, do their health check, everything. We have done their blood test, their BMI, their heart rate, blood pressure, everything is done. And we think nothing else is major going in their body. We need to think. And then we say what you would like to do. So then we say, normally it has to be a lot more physical symptoms, mostly is anxiety, palpitations, hot flushes, insomnia. These are the one HRT will mainly control, because then everything else will be controlled by it after. Because mostly women, when they say they are fed up, actually is from these symptoms. Because weight gain, maybe all these issues wouldn't that much bother, but anxiety, all these two, so all linked, hot flushes, sweating are the one which really affect her day-to-day life, if we say, because that's when. And then we say, okay, would you like, patient normally say, I want to have some medication. And we say, do you want to consider HRT? Then we clinically check, can this patient have HRT or no? Because not everyone can have. We check their family history, physical health check, anything else is going on, if they're on any medication.
Why would you check their family history?
Because if they have sort of a cardiac issue in the family, or because then we give the hormones on a different, because every hormone is like same contraceptive, is few different types of contraceptive combined or single, and then any family history of cancer can't have one of the hormones, but others can have. So then we need to decide on it. That's totally clinically related to each patient. So if someone have this, not same for any, and even same family, if someone go on a mental health medication or on a cardiac medication or on thyroid, we have to choose something different for them. And then
in regards to HRT and reasons a doctor would say clinically it wouldn't work because you might have had a cancer, what is it in the HRT which would affect? I'm assuming with cancer it would be estrogen, because obviously breast cancer is linked to it. What about thyroid and cardiac? What is that the same thing? Is it the estrogen?
Yeah, so because it's the hormones, not, we need to see what their is the history of cardiac. Is it because we still hormone are going to affect their cardiac health in a good way, but then because the pulse rate can be changed or any other, so then we need to complex comorbidities. So that's something we normally really check. If someone is on a proper cardiac medication, cardiac health, we normally deal with the specialist because they need to manage it. It's not it's going to cause something really bad, but it's always has to be with another specialist, because you take in really their health on another level. Is, something cardiac health issue causing that symptoms as well? So that's when we look into it. Normally GPs won't prescribe, if someone have very complex comorbidities, GP won't do HRT until the specialists have given a green light for it. That is something, every clinician is different and every patient is different, which we look. And that's something when we do public awareness, we don't normally say to patient, get anything sort of have negative feeling about it, because there is care, there is specialists there. But first is to try to understand the symptoms yourself. And then when we do give the HRT, if the patient, as I said, normal patient, which may be on just blood pressure medication or normal, we give them a choice, mostly start from the gel. Gel is easy to apply, it's low dose, it's not high dose. And if someone is suited well with the gel, it's not necessary it will work for them or no. So it's trial and error. Hormone is a trial and error. We say we will review in 6 weeks. If it doesn't work, patient don't like, there were side effects, or it didn't give any benefit in 6 to 8 weeks, we can try maybe the patches or something else. And then
I'm glad you said that, because I was like, is it tablet? Is it injection? So
no.
a gel?
I was going to say, gel is localized, and is it? Is that
Yeah,
just
but the way it's a delivery mechanism is the transdermal. So the gel you will apply on the thighs or your good muscle, and then it deliver the medication. You apply the pump, but it's the drugs formulation delivery mechanism. And same is the patches. You apply on your buttocks or on your thighs, and then it deliver the medication that way. There is tablets as well. A lot of women, we don't normally give the tablets as a first choice. Some, due to any lifestyle, it could be anything, they may want to go for tablets, and we can try the tablets. And always the hormone HRT start from a lower dose, and then you slowly see. And the woman is a then again, if women have a uterus or not, some women have uterus removed, so progesterone, they need to have progesterone or no. That's another thing which we need, because it has to be balance of hormones for both. And HRT is trial and error to see how effective it is, and start from lower dose, built by week, and we follow up. We book the follow up with the patient, and mostly it does work. Mostly women say the symptoms controlled.
This is really interesting. Yeah.
This is going in depth, and I'm like, okay, let's get talk about HRT even more. So in regards to the gel and the patches, at what point would, if I was a patient going through menopause, and I went there and said, look, I've got all the symptoms, I think it's menopause. If I am, when I say I don't have anything medically, clinically wrong with me, would the gel increase? What I'm trying to say is, what symptoms of mine is the HRT there to resolve? Is it the hot flushes? Is it the vaginal?
Hot flushes, yeah. Mostly is the hot flushes, sweating, sleep improvement. You will see that your bloating and that start to improve as well. And then your anxiety as well. Stress and anxiety, all will. Anything which has caused by imbalance of hormone, they will start to be on the way. But mostly women say, oh my God, my panic attack, my anxiety, my palpitations, my hot flushes, my sweating has improved. Because that's more on the surface symptoms, which is visible every day, which is they go through every day. Like bloating or weight gain or something is behind the surface. They are different. But this is, they felt like every few hours, some women do. So that's why that's just front face symptoms. And that when that get control, they start to feel better about themselves, and then they start work more on the rest of the body symptoms.
In regards,
and does it have to, sorry, we're like, oh my God, this is so interesting.
We may have to do another podcast to continue series.
It's so much.
Yeah.
And so if you don't have the hot flushes and you don't have the or you have anxiety, can you go for HRT then if you've just got anxiety?
So then normally is the HRT is given for mostly, so we call it vasomotor symptoms. They are given for this because you need to have some of these symptoms, because other symptoms, if we look for, if someone going to the urine infection or weight gain, we wouldn't normally give HRT to them, or bloating, because then there is something else to manage it.
Okay.
Yeah. If someone is going through bloating or that, then we give there is other medication which can be given to manage that symptom. Then we do say you need to change your lifestyle, eat healthy, have more nutrition, and balance your hormone, which way you can do to really exercise, really release good hormones in the body as well. Self-care release good hormones in the body as well. If someone don't have any other mental health or hot flushes, and that means that part of the body is in control, they only need to is eat healthy and do exercise then.
Can I ask on that HRT?
Then they don't need HRT.
Is there any other medication aside from HRT that would be prescribed?
HRT is the main to balance the hormones. There is new medication which has come obviously privately, but that is no HRT. That is not to manage your hormones. That is more to manage your vasomotor symptoms like hot flushes, and that where women really going through the hot flushes symptoms and they're really struggling, but they can't have the hormone or HRT. This medication will only cover on that symptom, but it's will definitely still is no HRT, and it's not to balance the hormone, is to control that symptom. So for example, I can say if someone really, that could be their menopause symptoms, because obviously hot flushes is a very sort of main menopause symptom, but it's very deeper than that anyway. But if someone really got indigestion and bloating, just they started when they're going through menopause, then we know we need to give something to them just to control that symptom for bloating, like PPI. And same, some women don't have any menopause symptoms, but their periods are so irregular. They very heavy bleed, clots, bleeding don't stop whole month. They have bleeding continues for 6 weeks or so. That is a menopause symptom. Then we only focus on that. We know what medication we need to give, what to give to manage the pain in that, how to stop the bleeding in that. So we only focus on that medication. And then obviously we refer to gynecologist, and then sometimes they end up having removed ovaries or uterus, hysterectomy. That's because that is a symptom of it, but they're not feeling anything else. They're only feeling that.
With this,
Can leg pain and headaches be part of menopause as well?
Yeah, it can be. It's a long list. Anything can be. And they're all linked to each other.
And can something be given for headaches, or is it just paracetamol and
Yeah, because headache is a symptom, and there is only thing you won't have HRT for headaches because headache is a headache, and then that's when your lifestyle comes to balance it up to control it better and taking control on your health.
this is basically the checklist for Taj. This whole
Yeah,
podcast.
but what I will do, I will once I send you my download scorecard.
Yeah, I think that would
And
be
you can put
amazing.
a link, and then women can do themselves, go through that themselves. I'll send both links if they want to do the online link or they want to print and download. And then they go through the checklist, and then, yeah.
In regards to the newer medication, and that came out on the news just a few weeks ago, well, a month or so ago. Is that more appropriate for people that clinically can't go on to HRT, like you said earlier?
Yeah, who can't go on HRT? Not everyone will go on it. And then it's, again, it's the doctor's decision. According to the patient, can they have it? Is it suitable for them? But at the moment, it's just come, obviously it's been evidence and research. It's not on NHS at the moment anyway. So yeah, so people can have means obviously in few months or by end of the year it will go on NHS, and then when it go on NHS it will be a very good guideline for clinicians to follow. And then if we go, whoever can go, but it wouldn't be if someone having lot of other symptoms, HIT would be the still the good. But if they can't have and they like there is patient who only have hot flushes, nothing else, it will really be a magic drug for them.
And now let's bring it down to, because this is a podcast for the South Asian community. And
I've got one more question on medication. Sorry, Dad.
So go on.
Before you do that, vitamins. Now, this is something that I've been thinking about quite a lot, just for general health. Do vitamins benefit someone that is going through, from the 30s up to...
Yeah, vitamin does. It depends what type of vitamin you have in and is it from a good resource. It will help you. We always say start to try to get from your diet, but it's not always possible to get. But it all depends how deficient the person is as well. Vitamin does help to boost it as well. And if it's from a good resource, good company, and there is not too much sugary stuff like these days, I'm a pharmacist, we make drugs. That's what we do. We make these things. We know what formulation go, but it's so many different styles of chewing, coated. You don't need that. That is doing more harm than you to benefit. You don't need, just keep life simple. And that's why we have more problems than actually we resolving them. Keep your life simple. Just have a normal in the form of tablet or a liquid, and that's it. And these days we see chewing gum and sugar coated, and this like if it's a vitamin D, it's a vitamin D. Just have the vitamin D in a tablet form, end of it. But they are marketing and business. They do okay, whatever the ways. But it will help to. If someone is deficient, they need extra boost of it. And then obviously you're getting from the food, but then it all depends how much the good nutrition value is in that food as well at the same time. Yeah. But seeds and that are good, especially for our South Asian community. As a pharmacist, I will strongly advise flaxseed, linseed, sunflower,
pumpkin. You're doing good. Well done.
Yes, sesame. So and I do eat all the time. I eat all the seeds. Omega acids in them. It's really good for your bone, for flexibility. So yeah, that's why I eat.
And the
yeah, it's good as long as you haven't added a bulk of sugar in it and then too much of dairy into it. Add your sugar and then maybe some gram flour to make that whatever way. You don't have to make fancy style. And then ghee is good for you. Have ghee. It's a good ghee. Ghee is good rather than having a butter or refined oil. Have ghee as long as having in a good limit. Have it, and that's really good for your bones, your energy, your brain health as well, bone density as well, and that's what is good. And the seeds really do good justice to all of our this our women's health as well, and along with the bounce and everything, and gastric health as well. So I really highly always recommend go for the, and that will have everything into it as well, calcium as well into it as well at the same time.
You know, are you seeing in the South Asian community that there is still this lack of engagement and facing menopause, or are we getting better?
We are getting better, but it's still because we're still not opening talk. Because if we look back in our South Asian community before, periods were never discussed in the families. Yeah,
I
it
was
was always
saying that
hidden.
my daughter came back and she had just done a lesson on periods and reproductive health, and she's like, "Mama, I can't take this. I can't believe, you know, how I was."
It's still that.
I was going to say, get her to listen to this podcast, then that's it. She's going to be done.
And then she came home and I go, let's talk in front of Dada about this as well, because we need to be honest about it. He was like, no, no, no. And I go, I don't care if you say no. We're going to discuss this as a family, because we need to build awareness that it's important that we aren't hiding it under, you know, I've forgotten.
And the same openly talk with your sons as well all the time, because that's it need to be, regardless you have daughters or now, just talk, because they need to know as well. It means periods is fine now, but then the menopause is like women just get the label, she's going crazy, midlife crisis, she gone bipolar, and that's it. No one try to understand why actually she going, and that's why the families need more awareness, and women themselves need more awareness as well, and not have resistance to anything, not openly talk, because by learning something, you're not going to harm yourself. You're only going to gain something, and you never know what stage you're going to realize actually this is, if not for yourself, maybe for someone else in your family, neighbor, friend.
Why, when you're going through perimenopause, do you snap and do you get that, oh my God, kind of thing, the frustration? Is it hormone imbalance? What's happening?
Hormone estrogen so how it works, because our body release dopamine, good hormones and the bad hormones. That's the different hormones it's release our brain, serotonin levels as well. When people start to go, estrogen balance our serotonin. If we get imbalance very low, then that's when women have depression or low mood. And the same, the dopamine levels is, and how we get our sleep as well, and progesterone hormone balance those, and when they release, and then the imbalance of release has happened, we will get more anxiety or snappy or frustrated or agitated at the same time. So because estrogen, progesterone are the hormone which are linked to other hormones in the body, like endocrine system or dopamine or other, and that's when then, because they know helping them, it's like mother of the family is not working, the rest of the family go way hog, like they do whatever they want to do. Exactly, it's the same. Estrogen, progesterone stop working, and then any hormone linked to it, they just want to do whatever they want to do. Basically, if I have to explain in layman terms, in simple words.
Yeah. Before you have to listen to any more of Taj's symptoms, you know what? That was really interesting.
So amazing. Thank you so much.
I'm going to go down and talk to my husband and be like, okay, I think this is what's happening now. I've learned, and this is the point, though, isn't it? If we raise that awareness, we can have those conversations and get prepared ourselves and people around us.
Yes.
What advice would you give someone who just isn't sure about the fact that they might be going through menopause, or is there something else? As we come to the end of end of this episode, what advice would you give those women?
So the first advice I would say, if you have notice yourself, you are changing, either physically, your body appearance, whatever is changing, anything, research, you may have online link, or if not, go on NHS or a GP, wherever you can find, write down the symptom, what is changing in your body. And as I said, the 3 links, the mental health, the physical front of the surface symptoms and behind of the surface symptoms. Make a list and how it's affecting you day-to-day life. If it's affecting you, you having at least 3 to 4 times a week, it means you are not the same. If you notice you are not the same woman, why you are not, and then see how you can little changes do yourself. If it's really forefront symptoms are on the front of your body, you feeling every day, or people notice, go see your GP, because that's your first point of call. Explain them, this is what's happening, write everything what you're going through, what is different in your body, and then discuss openly with them. And obviously, the GP going to, or I will advise, if you come to me as a clinician, I will definitely say, change your lifestyle. I will check what you're eating or not. So do the different tweaks, what is protecting your mental health and the physical body as well. And then exercise, self-care, everything, every little will help you. And then discuss openly the HRT for GP, or speak to an expert, or speak to a friend, whoever you want to. There is a lot of help around on social media, on websites, but then don't fight on your like behind the scene and just lock yourself off it. The more you will talk, if you're speaking to 20 people, I am not the same woman. I don't know what's going on with, they don't need every list of it. Someone will give you advice or refer you. And that's how you learn day by day about your body, about the change, and taking the control back in your own hands as well. And then you can tell people in your family, when I'm snapped, leave me alone. That's how you manage. And then they kind of learn. They know you're not the same hello, hi lady. Okay, she's gonna agree to everything. No, you're not gonna agree to anything now. Everything is end of the world for you, and you take in charge.
Now
Before,
listen to that.
yeah,
No,
yeah.
I've learned to back off.
Yeah, because that's what first things start with the woman, and then hey, where she come from, like giving me answer back.
That is exactly that. Oh my God, Veerpal,
Yeah,
you are literally taking the words out of what I've already said that about Taj. I'm like, oh my God, I won't say anything. And
yes,
that's really
yes.
helpful because
And then you tell them this is what you're going through. You are gonna be worse than this. So either you
oh
help
well,
me or you help
oh,
yourself. Means you
we'll look
won't go
forward to
worse
that
than
now.
that. But then because what happened is everyone's so used to you be so quiet. But that's why I say it's a new chapter. This is for you, no one else. And that's why you take control back, because it's a new chapter of your life. You're not the same person agreeing everything to the parents or siblings or at work or everything. Because when I was a pharmacist manager, and I had a really nice lady worked with me, and by the time she went into menopause and forefront in a pharmacy, and I'm a manager, and she used to work at the counter, the like refs, like she will really give answer back to the patient, or really get when she had that moment angry and just get out of my shop, and then it come on my head as a manager. But then I knew what she was going through, and then I totally saw the different side of her that time. She would not take anything from anyone. It's not she was wrong before she okay sorry apologize,
Oh my
even the
God, this is
person was
sounding like
wrong.
me. Yeah.
Yeah, that's what happened, because she was so used to agreeing to everything every patient said, shouted at her, and she just take in, apologize, so sorry. And that's another side comes. She would say, I'm not listening to you. And that's when you start to see things are changing, and take a control and honor, and don't let someone to just say you are bipolar or you're a mad woman. You're no, you are actually real woman. They haven't seen it for so long in you.
Do you know what, Veerpal? I think the two things I want to say on this. Firstly, from a South Asian woman, where it's a case of where we have grown up saying yes, 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 that is a complete shift. And if people realize the reason for that shift, that is such an important thing just for our community to understand that
Yeah,
you will go from going from saying yes, yes, yes to actually answering back, which is a massive cultural change as well in the
it
whole.
is. Yeah.
The second thing I'd say is I feel like Taj brought you onto this podcast just to have a go at me, to be fair. We've been having these discussions.
Yeah.
But
No, it's been a real big eye opener. It
Yeah, but
really.
we can do another series. Just gather what feedback you get.
yes,
I'm doing a lot of workshops with the different charities and with others, and obviously I see my patients, private and NHS, because I work with a lot of women, and every woman is different in menopause. Every woman I see in my clinics, everywhere is different. And if you feel like there is something has built and few questions, we can do another series on it, and maybe touch more on mental health or something as well, because it's all help raising awareness to normal people, and then they learn themselves.
I think we've just got evidence that you're going to have to help us now because we are doing a series. Thank you very much.
I'm happy to help you. Just let me know. Yeah.
Brilliant. This
Yeah.
has
We
been
are,
amazing.
on that point, we are doing workshops in regards to menopause in Swindon. They will be advertised on our social media, so please do keep in touch. And we are being supported by the NIHR, so thank you to them. And also come along, because this is the time that people can get together, talk about the
Yeah.
symptoms. And we will have medical professionals. Now, Veerpal said it as well, so she'll be there at some point.
Yeah.
But thank you
Yeah.
so much. It has been an absolute pleasure. And do you know what I love the most? The passion that you speak with. I'm like, oh my God, she's got so much knowledge.
You're so
That's yeah.
positive. I like the fact that you're so positive. Now I actually feel like going and doing these things that you
Yeah.
suggested.
Yeah.
And okay, like GP, like you said, I think I've been thinking, oh, let's go to the GP, but it isn't that. You need to think bigger. You need to look after yourself, and you need to research yourself and understand yourself. I
Yeah,
think
and
that's
then
the big takeaway for me.
yeah, because clinicians, we are there to job and help the patients. There is no way if patient really wants something and we know clinically right for them, we will refuse it. But it's all come from the patient. They take in ownership. This is actually going wrong, and then step a break. And then GP always give an option what you would like. GP always say what you would like me to do. And then don't be resistant not to have HRT. GP will check clinically, is it right for you now? Because everything is on your record. And if they say, okay, let me try for 4, 6 weeks, it's not going to harm me. And let me see how different I am. And if it doesn't suit you, you stop it.
Very good
Yeah.
point.
Yeah.
Thank you so much for your time, Veerpal. It's been
No, that's fine. Thank you for having me. And
fantastic.
I will drop you the links later this evening or tomorrow so you can add on your podcast whenever you're ready. Okay.
We'll put this out when this podcast does go out. So please do keep your eyes open for those as well. Thank you so much for your time, Veerpal.
No, that's fine then. Thank you so much for having me, and lovely to meet you both.
That's goodbye from me.
Okay.
Follow us on
Veerpal. How are
Instagram
you
and
today?
Facebook.
Hiya, I'm very good. Thank you for having me today. Yeah.
So you never
Thank
miss
you
an
very
episode.
much. Now, in regards to menopause, when you say you're a
Hey,
specialist,
Val, I'm going to stop you there.
oh, that was quick.
What's that? So, can we find out, first of all, because it was only through podcasts that